Hello, everyone. I'll be speaking on predicting the drop, a prospective observational study to determine the accuracy of oxygen reserve index to predict impending desaturation in apneic procedural patients. So the pulse oximetry provides, the background of my study is that pulse oximetry provides continuous non-invasive assessment of arterial oxygen saturation. The shape of the oxygen hemoglobin dissociation curve is sigmoid shaped, and once the decline of PaO2 passes the inflection point, the SpO2 decreases rapidly and desaturation ensues. Oxygen reserve index is a relatively newer technology which is a dimensionless index ranging from 0 to 1 and developed by Massimo International and provides insight into the patient's oxygen reserve in the moderate hyperoxic range. The aim and purpose of our study was to determine the accuracy of oxygen reserve index to predict impending desaturation in patients undergoing procedures under apneic oxygenation. The primary objective was to find out the time lag between the ORI alarm at 0.24 and the SpO2 drop to 95%. The secondary objectives are the time taken for the SpO2 to rise to 100, the ORI rise to 0.24, and the time difference between the two during reoxygenation. The methods were, it is a prospective observational study. We included ASA 1 and 2 adult patients between 18 to 80 years of age undergoing procedures under GA with apneic oxygenation. We excluded patients with respiratory ailments, poor pulmonary function, and patients with nail paint. The ORI probe and the pulse oximeter probe were attached on different fingers of the same hand, and the NIBP cuff was applied on the opposite hand so as to cause minimal interference in the readings. Patients were pre-oxygenated with 3 minutes, and the ORI and SpO2 probes values were noted. Descriptive analysis was done using mean and standard deviation. We recruited a total of 39 patients, out of which 28 patients achieved the primary endpoint of fall in ORI and alarm along with the SpO2 alarm at 95%. In all these 28 patients that achieved the primary endpoint, the ORI alarm preceded the SpO2 alarm, and the difference in the time was 90 plus or minus 62 seconds. The median time during reoxygenation between the ORI rise and the SpO2 rise to 100 was 22.5 seconds. So, to conclude, from our study, the oxygen reserve index is a useful adjunct to pulse oximetry to monitor oxygenation and accurately predicts impending desaturation in patients undergoing procedures under apnea. This advanced warning may be useful for calling for help in modifying the airway management strategy, thereby adding to patient safety. The limitations, however, are it is currently available as a disposable probe, and when used as a reusable probe like a pulse oximeter, it would be useful in increasing the patient safety. Thank you.